Hello and welcome to this program titled Finding the Path in Eosinophilic Esophagitis, Interdisciplinary Strategies for Adult and Pediatric Patients.
So what is EOE? EOE is a chronic type 2 or a T2 inflammatory disease of the esophagus. As you know, it causes classic symptoms of esophageal dysfunction, such as dysphagia, untreated disease, esophageal strictures and food impactions, and reflux symptoms and feeding problems in children.
So I think it's both a new disease, but a lot of the exponential rise is driven by increased awareness.
So now we're going to call a patient, and we're going to call Nicole, and she's a 40-year-old woman with EOE, and two out of her 3 children have EOE. So it'll be interesting to hear her story and how she's gone along and developed EOE and how she's handled it. So when we hear now from Nicole.
Hello there, my name is Nicole and I'm 40 years old. I can't exactly remember when I started having EOE symptoms. It was definitely in high school, maybe even before.
Typically, biopsies are obtained from the proximal or the top half of the esophagus and the distal or lower half of the esophagus. And histologically, finding 15 or more eosinophils per high power field in the maximally affected area is necessary to meet the histological criterion for EOE. And for that, to go over this, I'd like to give Dr. Margaret Collins a call. She's a pathologist with expertise in EOE. Hi, Margaret. I was wondering if you could walk us through a pathology report for a mock patient with EOE.
Sure, Myrna, I'd be glad to.
You just heard from the world's expert on EOE histology, and I'd say most pathology reports that I see come across my desk, do not have that degree of detail about the ancillary features. Now, I'd like to give Bethany Dorfler a call. She's a dietitian with me here at Northwestern and an amazing resource for our patients. So, Bethany, can you tell us how you help patients get started with dietary therapy? I want to summarize just two phase 3 clinical trials that have been conducted in the U.S. looking at the efficacy of 2 agents. These are the furthest along in product development. The first is a swallow steroid preparation that's optimized for esophageal delivery. This is BOS, or the budesonide oral suspension. Success of dupilumab in a phase 2 clinical trial led to its study in a phase 3 clinical trial, which was presented in abstract form at scientific meetings. And I want to summarize the key data from the phase 3 dupilumab data for eosinophilic esophagitis.
So having a biologic that could address several diseases at once would be very appealing.
When I think of these biologics, I think of all my patients that have multiple atopic diseases, asthma, allergic rhinitis, atopic dermatitis, and EOE, which is, in my practice, relatively common. And it'll be great to have one drug treating everybody.